Welcome to the Portage Health Foundation podcast. My name is Michael Babcock. I am the host for this intermittent podcast that comes at you whenever we have a chance to talk about something really cool, which is exactly what we're doing right now. We are talking about bridges out of poverty with Treasure McKenzie, all the way up from Muskogee, Oklahoma. Treasure, we're so happy to have you in our community.
Thank you so much. I love it here. I think I want to move here.
Oh, perfect. There are plenty of houses available. Just move quick.
Do you have resources for me available that I could use?
So many.
Okay, great.
So many. We also have Kevin Storer on this week. And for those that are listening audio, we actually have a video too. So if you go over our YouTube channel, just search for Portage Health Foundation on YouTube, you'll find it, and there's a video of it. But we're also going to do the audio one as we normally do. So Kevin, welcome back to the podcast.
Thanks for having me again today. I'm glad to be here and really very glad to have Treasure joining us today.
Yeah, and this is something we've been working on for more than a year to bring her up here. We had this planned before the whole COVID-19 thing hit, and we're really happy to have started. Today we did our first one. We had about 50 people in who were actually at the bonfire at the Continental Fire Company. I think that's the official name now.
It is.
It's a beautiful facility. If you guys haven't checked it out since they redid it, definitely stop by and check it out. We're so thankful for them for hosting us. And let's get to the topic here. Treasure, what is Bridges Out of Poverty, and why should people care about it?
Right. Bridges Out of Poverty is a community-wide collaborative to help communities address generational poverty. It's a curriculum for people who are in poverty who would like to get out, but it's also about educating the middle class and the business community about the complexities of poverty. So we're lifting the whole community at the same time.
Excellent, excellent. And today we did a bunch of different activities that were on that, and it was really, really fun to do. So Kevin, you've been through a bigger version of this training, and now you've sat through this one today with 50 of our people from our community. What about this program has you so excited?
I like that it's a multi-sector approach to addressing not just poverty, but a lot of the other systemic risk factors that exist in our community that result from poverty. So a lot of the social determinants of health, other initiatives that we're working on at the foundation, our food insecurity, our drug enforcement, drug addiction, SUD addiction, our access to education, all those other areas that we're working through. There's a common thread, and that's poverty. And we met Treasure about 2 years ago. It was 2 years ago this past May, and heard Treasure speak. And I made a comment. I had actually at that presentation, I had an out plan for noontime, thinking that, you go to some of these and they don't resonate, the information's not good. So we figured, if this isn't working real well, we'll bug out of there at lunchtime. And we got to lunchtime point break, and I looked at one of the other people I was with, and it's like, we can't go anywhere. It was so relevant, so practical, but also very applicable to what our community needs and what we're going through. So we're actually really grateful and thankful that you came to join and share your experience with our community. So thanks for doing that.
You are welcome. I am so excited to see what your community's future story is going to look like when you take this information back and start implementing some of these ideas. I think it's going to change the landscape here.
Well, the first time I heard Treasure speak about the whole concept and the constructs of Bridges Out of Poverty, compelled me enough to go to the annual conference a few months later on. I think we were in Indianapolis, if I remember right. But what I enjoyed about that experience, and it was an experience, was the unlike a lot of conferences, there was just this overwhelming willingness to share information and share resources, to share experiences, because I think the focus, I know the focus is all about helping people and helping individual communities help the people that live there. And one of the other things that in that whole experience of everybody sharing information was that cross-sector engagement. We had businesses, we had manufacturers, we had people from education, but most importantly, you guys had people that have graduated through the program sharing their story. And for us to be able to bring that back here, and today we had half of the group of people that volunteered. We had almost 50 people of all different sectors coming together. So I'm pretty excited about where this is going to go. I'm pretty excited about what's going to happen with this.
Yeah, and we've kind of danced around some of the aspects of this, and the fact that this really affects an individual group of people. Like, this is not just going to be some blank thing you can log on and do. You're going to have to sign up, and it's going to very drastically affect people's lives. Tell us what you guys did in Muskogee, because I think that that's what's most exciting to me when I heard this, is you guys are 10 years in now. What's happened in that 10 years?
Right, we are 10 years down the road, and you guys are kind of at the beginning of this process, and you don't have to reinvent the wheel. There are communities that have come before you. And so in Muskogee, Oklahoma, we did exactly what we've been doing here today, inviting all of the sectors into the room, learning the constructs, learning the vocabulary, so we are all working together. From here, next steps would look like what we did. We created a steering committee of people who were passionate about this work from every sector of the community, and then we created Getting Ahead and Just Getting By World classes for those people who are under-resourced or in poverty to transition out of that. And we've created Staying Ahead classes for them to continue to be involved in our Bridges family. So that's when I talk about we are lifting people out of poverty. It's just half of what we do, but the other half is educating the business community about the complexities of poverty, because hopefully these people are hiring these people. And when we're all working together as a community, and that's kind of where we are now. We've graduated over 338 families from Getting Ahead class, and think of that as like all their kids are being affected, and it's a ripple effect in our community. And we're really truly changing poverty in Muskogee using this curriculum, but it's not just one person doing it. It's our whole community working together as a collaborative.
I like what you said too about how you have people that have graduated through the program, and you've had businesses that are participating in the program. But what's inherent in there, what's implied in that, is that there is an organic approach to spreading the benefits of this program as those families, and that influences other families in their peer group, as that influences those businesses. So when you think about it, Mike, from a workforce development standpoint, our business community will benefit from this program. They will benefit from the business resource and employee resource networks that can develop out of this to help make them have a more stable workforce and actually provide a better, more meaningful work culture. And in turn pass that benefit on to their customers in terms of quality and consistency if they're manufacturing, or hospitality, and how that translates to the experience. When we talk about education and access, we already have a group that's working on under-resourced college students and how we can create a better path for affordability for people that are seeking post-secondary education. So there's so many facets of this healthcare. I mean, you gave an example today about how a healthcare system changed their appointment structure from not 9 a.m., 9:15, 10 a.m. to your appointments in the morning or afternoon because of people that might have difficulty with childcare or transportation or other barriers to getting access to healthcare. And we had a healthcare administrator today say, I didn't realize, so there's an aha moment. I'm going to take a plug from what your program is, but we had a healthcare administrator stand up and say, it's making me think. I had this moment of how our policy is not real friendly to people that we're trying to serve, that are and in most cases at the most risk. So I think that there's a real benefit here, or opportunity, not benefit, but real opportunity for all sectors of our community to realize the benefits of this, and at the same time really helping our friends and neighbors to be included as part of the community. I think you brought that up today too. There's that overlooked segment of our community that we're trying to make an awareness to.
Yeah, and Treasure, I'm going to put you on the spot here. I don't need you to give exact numbers, but one of the things you had on your slides was talking about there's the 300 and some graduates you've had. Tell us, what are the factors you're looking at after to see if you've been successful?
Right, so we call all of our graduates every summer just to check in with them, get some outcomes. Of course, funders like outcomes. And so when we're talking about, what do we consider success? Well, we don't necessarily think having a pile of money is success. We think stability is success, and the more we can stabilize a family, the more successful the whole community is going to be. And so when we're talking about graduates of our Getting Ahead program, we ask them, have you increased your income? Have you decreased your debt since taking the class? Have you increased your education level? Are you now banked? But the most important one is 73% of our graduates have said that they are now off social services. Do you know how hard it is to get off social services? It means you're no longer on SNAP benefits and no longer on Section 8. Maybe you've got a better job with benefits. You've kept that job longer, and you're really contributing back to society, and you're saving our community a lot of money just in social services alone, but the burden on the healthcare system, the burden on the ERs, the crime rate goes down. It's just the overall effect is positive for the whole community.
Excellent. Now we've heard kind of what this program is, what you did in Muskogee.
Mm-hmm.
I keep wanting to say Muskegon.
I know,
It's
there's a Muskegon, Michigan, right?
Yeah, it keeps screwing me up.
I get
but
that a lot.
We're going over to the future of our area here, the Copper Country, Houghton, Baraga, Keweenaw, Ontonagon counties. Kevin, what do you think is going to be happening here in 5 or 10 years? What do you think this program will look like here?
I think that we're going to, I think that we have the potential to be a showcase Bridges community. I believe that. I think we have the right ingredients at the table right now to bring it all together and really serve this community and bring this program provides a framework for the willingness and the passion and the work ethic of this community to come together and actually have real change. And we had an exercise in today's session that talked about, what does our community look like in 20 years, I think was one of the final sessions he had. And there were some interesting things that were talked about. And I'm going to bring that back to, one of the components of the foundation's vision is to not only develop the collaborations and foster those relationships, but also to help influence what a shared vision is for our community in terms of what does it mean to have a healthy community. And people will think, well, health foundation, healthy community, well, you'd have people getting access to medical care. No, we're looking at the civic and economic vitality. How does it feel? Do you feel good living here? Do you feel welcome? Do you have a healthy lifestyle? Are your kids taken care of? Do you have good schools? Those types of things are what we're looking at as a healthy community. And I think this was probably one of the more significant collective conversations that we've had as a community to come together with a common vision. And I think in 20 years you're going to see an entirely different community. I think you're going to see the influence of this program, and I think you're going to see a lot of people that are going to be able to come out of poverty and be able to pursue their own form of liberty and their own aspirations in a way that they're not right now being supported to do that.
Yeah, it's amazing.
So.
Yeah, at the end of the session today, we had to pick one word. My word is inspired, and that's all I'm leaving here with. And if this is something that you're hearing and you're excited about, reach out to us, info@phfgive.org. You can find all of our information at phfgive.org. Contact us. Sit down and have a cup of coffee with us and share what your ideas on this are, because this isn't going to happen without a full community buy-in. And if you're hearing this and you're excited about this, we want you to be part of it. And it's just getting started now, so now is the time. So thank you, Treasure. Thank you, Kevin, for being on. And we'll see you guys next episode.